Thank you very much for giving us the opportunity to provide opening remarks. Today we'll talk about how we manage heart diseases and how to live healthy with it. We would like to acknowledge that our iCON office is situated on the traditional, ancestral, unceded territory of Musqueam, Squamish, Teslevatlat peoples. I would also like to acknowledge that you're joining us today from many places, near and far, and acknowledging the traditional owners and caretakers of those lands. And I will ask Ripujit to tell us about her. My name is Ripujit Karundava. I belong to city of Bathinda, but I was born in city of Faridkot. I did MBBS from Ludhiana, then MD anatomy from Amritsar. With that, I'm connected to Panjabi culture, and I joined the dance, Gidda, Uli, and Pangra teams of the college and MC College. With my education, I joined culture programs and I also joined conferences and as well. And I was attached to different forums. Thank you. Let me tell you something about myself. My name is Lean, and with iCON for 6-7 years. Other than joining iCON, I'm pharmacy specialist in medicine, and my purpose of today with iCON is that you understand about your health, about your rights, so you know about those, so you can get information about your health. You can get all the information today so that you can take care of your health in future. What is iCON? iCON is Intercultural Health Network. It's with the University of British Columbia with the digital emergency medicine. With iCON, Ministry of Health also supports iCON, and they are partners with it. Why iCON does this programs? To assist multicultural and indigenous citizens, patients, and caregivers. If it is you or your family member, or your healthcare team, your doctors, pharmacists, dietitians, or your physiotherapist, occupational therapist, any team members that assist you, so you can get information about that. So our focus is to optimize chronic disease prevention and self-management. There are many examples of chronic diseases like hypertension, blood pressure going up, diabetes. You can also call it blood sugar. And these are just examples of some chronic disease. The chronic disease, why they are so important? Because sometimes they are with us for so many years, sometimes we don't know how they will affect our health for longer years. Sometimes we have it for so many years and we don't have any problem. Sometimes you have blood pressure, and for many years those can occur, and it can affect your heart, and it can affect your brain and your kidneys. It can affect your kidneys as well. So about all that we will talk, and we wish to talk about those so you can get all information about those subjects. We also want you to know if you want to get some information online, if you read anything online, then you should know what you're reading, it is reliable or not. We also want to tell you that today. We also want to tell you the professionals, the specialists that we have today, you can talk to them today.
Our next speaker is Dr. Guljar Cheema, who is a family physician. Dr. Guljar Cheema, 2001. So he presented the Surrey Panorama, June 5th, 2001. Dr. Guljar Cheema, he became a mental health minister, and and he was a member of BC. It's not only BC, but in all different provinces he served. Dr. Guljar Cheema is one of the founding directors of iCON Forum. For last 12 years, Dr. Guljar Cheema are connected with iCON. Right now, Dr. Cheema is a family physician. He's practicing in the Department of Family Department in University of British Columbia. So I'll request Dr. Guljar Cheema to come on the stage. Thank you so much. First of all, I don't have the slides in front of me, but I'll try my best to use them properly. It's like sitting it in my office, and I'm sitting with a patient in my office. I'll try to explain things to you the similar way. I'm beside being a doctor, I'm a full-time volunteer as well. Whenever they need me, I'm there. So the program we from last 12 years, they have seen live this program 50-60,000 people that we have established in UBC. They are funding, and then all our children who are working there are learning. Their Punjabi is getting better, and they are serving in Punjabi, so they are getting better. I think it's working now. So it's okay. I'll try my best how to do it. First of all, I I take my glasses off. What is heart disease? We go to the family doctor for our illness. So we say I have a heart disease. The basic in basic language, any function of the heart, blood vessels defective, or the blood is not flowing properly. Is it okay or not? Are you there? Okay, it looks like my luck is good. What is the definition of heart disease? If there is a problem with our blood vessels or when it's beating, why you are ruining my program? Let me do it on my own. You just shut it off. My speed is not that great that I can cope with it. Any problem in your heart rate problem, if your heart is not functioning, if it's about blood supply, any problem with the heart it is called heart disease. The main thing is why there is a heart disease. What are the causes? First of all, if your cholesterol is high, your blood pressure is high, your blood sugar is high, and if beside that, if you are smoking or excessive use of alcohol, it could affect your heart. Leave leave the slide out. We are all um, simple people. They will understand what I am talking about. First of all, when you go to the doctor, he will do your blood test. And then he will tell you to check the blood, check the sugar, check the cholesterol. This is the first thing he will tell you to do. It's normally present in our body. There are two types of cholesterol, LDL and HDL. And the good cholesterol is HDL. It's good for our arteries because it maintains our arteries. Uh, just like every part of our body needs a blood supply, heart is the one supplies the blood. If the bad cholesterol goes up, then our arteries get the arteries that supply blood that get clogged. when your doctor is going to tell you that your cholesterol is up, the if your whole cholesterol is less than 5, if your LDL is, and ask about good cholesterol, bad cholesterol. If there is anything wrong with the cholesterol, then that means you might have a heart problem, so that the doctor will prescribe medication for that. Just because if you cannot say that after 1 week taking medication you are doing okay, you are well. It takes 6 months to a year, and the patient has to be on medication for for the rest of the time. One thing that we should note, and everybody says my diet is good, I don't have any problem. Why my cholesterol is up? You should all know our liver produces the cholesterol, but it's the liver that produces the cholesterol. But the diet factor is very um, little effect on the cholesterol. But the worst thing is sugar, the blood sugar. Every fourth person in our community has the diabetes, type 2 diabetes specifically. What is type 2? Naturally, our body stopped uh, when glucose is increases in our body, when our insulin is not working, and then it start damaging our blood vessels. And then with the combination of cholesterol, diabetic patient, and their heavy weight, or who are using excess alcohol, then the chances of for heart disease is more for those. So that's why whenever you go see your doctor, your family doctor, let's check your blood sugar. He always tells you. So the 3A1C, the most it has should be 7, but preferably below 6. So continuously your sugar in the body should be right. Next thing is blood pressure. What is blood pressure? Yeah, so our heart is not, our heart is pumping the blood to the body. The upper blood pressure and the lower blood, systolic and diastolic. That blood pressure, the normal range is, most of you who are here, it should be 140 over 90, about that. The two or three things are very important when you go to see your doctor. When you go, if you have eaten well and the blood pressure is, you can go to a pharmacy, you can check your blood pressure, you can, what that's, there is a way to check blood pressure. There should be a proper instrument, and how to use it you should know. Then it's very important to pay attention to that. There are blood pressure machines in the temples, gurdwaras, pharmacies. They will tell everyone that you have high blood pressure. So it's not that you check it once and you are diagnosed with high blood pressure. It's very important how you check it, where you check it, when you check it. Why blood pressure goes up? If you have higher sugar in the blood, then you will gain weight. In our community, s- our weight is genetic material is different than everybody else. So the combination of weight, because excessive food, excessive alcohol, not managing stress, not managing health, not managing cholesterol, not taking medication, and even with taking medication, not taking precautions, these these things are very risky for our health. So the most important, in my 45-year practice here, we prescribe the medication. It's expensive. They, there is no and there is less income, and they don't buy the medication. So try your health is very important. the medication for blood pressure for your health is very important. So you manage all these things. So we can buy a ticket to go to India every 6 months, but not the medication. So the people who are excessively drinking, if they can buy the alcohol, buy the bottle. So these are very small things you should, but it affects your health. You must have noted people have arthritis. There is inflammation, swelling, different types of inflammation. Those people, some, then they also have heart problems. Some of those patients. So the big key points I will share with you. First, we were thinking about smoking. We thought our people don't do smoking, but now we know the older generation is doing it. The new coming generation is doing it. It affects body really badly. I was reading something else. The environment, the pollution, very small particles in our environment, pollution, it goes into our lungs and it goes to our blood, and they are damaging our heart. So when you go visit India, you are all right, and then you have problems when you go there because the pollution is very risky for your health. Before there was no heart issues. I'm repeatedly talking about excessive drinking of alcohol. There is no energy in it. It's n- n- so if you are drinking in the morning, in the evening, no use of that. People who drink, some people say, I only take one beer. It, you drink beer, wine, 2 to 4 ounces. I drink that affects the body same way. It damages the liver, especially 5, 7, or 10 drinks take daily is very risky for them. If you talk to a patient, how much you drink? He will say, I didn't drink all my life, just like a medication. But that's just you have to make a firm decision. You have to make a determination. If there is a mental health issue, the solution is not the alcohol, then you will feel actually more depressed. The key part is the heart health is your diet, how much you eat, how much you need, 3 to 4 times, 5 times more excessive eating, how much carbohydrates, how much fat, what kind of fat, which butter you are using, how much you are using, how much activity you are doing, how much time you spent in front of the TV, how much time you spent outdoor. These are all the things that affect your heart health. As long as if you don't manage your diet, nothing is going to help. The more the bad habit we have, the worst habit we have, they will spend time. But when you do the grocery shopping, 15-20 minutes later on, they will buy the groceries and come back in the parking lot. No, you don't read the labels, what you are buying, where is the expiry date, where it came from, how many times it's sitting in the store for how many months, where it was, how much sodium, how much potassium, and so all those things should be kept in mind. So then, otherwise, it's not gonna. Otherwise, it will be risky to your heart. So there was one time, 50, 60 years ago, no movies were watching. Everybody was fit, physically fit, active. Food is the was not that amount of food was present. Everybody was taking small amount. The food production increased, and then we are excessively eating, and inactivity is high now. So we gain weight, our blood pressure goes up, our sugar levels go up, stress increases. So to avoid all these things, 30 to 35 minutes at least, 5 or 6 times go for walks. Sometimes people say I'm doing so much exercise, I go to gym. If you go for to gym for 10 minutes and excessively eating, then there is so many wrong conceptions in our mind that on weekend eat excessively drinking, eating more, all these things. These are very important things. There are a lot of things that is not good for your health. If you if you take care of your heart health, is very important. You you yourself, your family doctor. So just see one doctor. You don't have to see three doctors. Counselor, you can see. You can take advice, and when once they tell you how much function your heart is performing, this much your sugar levels. So to maintain those things, just prepare a file in your house. Before it was not needed, but now it's easy. The family doctor can give you the report, check your sugar, check your cholesterol every 6 months. See, see your eye doctor, see cardiologist, get your eyes done, because if there is a cholesterol, it will also affect eyes. All these things, because without heart, your body cannot function. So the health heart is very important. So all these factors are in your hands. Take charge of your health. So family history also affects heart health. So if the rhythm, the heartbeat, there are specialized tests, specialized services are available. So like you are all sitting here. These are the simple things, very common things. So keep in mind all these things. Maintain your heart health. So exercise on time, watch your food, go talk to family doctor. Don't excessively eat. It's a complementary medication. Ayurvedic, homeopathic approaches, they don't hurt as long as you consult it with a family doctor. They are not harmful as long as you talk to. So if just to check if there is no interaction, whatever medication you are taking with these other. One thing I want to mention, when you travel to India or Pakistan, whatever your doctor worked for, don't waste it. Take your medication, take your prescription, and don't. If somebody says a kind of medication is not good, or it's not, it's practical things. Don't change your medication when you come back here. Bring your see a doctor, see a pharmacist, talk to them. And along with that, if you are suspicious, if there is a problem, talk to your family doctor, consult your family doctor. Don't go to. So it's a spiritual role with the spiritual people going to play. They're not gonna fix your heart. Just take care of your heart from beginning to end. As long as your heart is working. So all these things that I discussed is common things, simple things. Pay attention to that, folks, and prevent from all those things I mentioned. I will answer your questions later on. Whatever question you have, don't consider yourself that I'm not going to be okay. So thank you.
Thank you very much, Dr. Cheema.
Dr. Cheema, first question for you. The question is, the medication are given after the heart operation. How is linked with the dementia or or Alzheimer? The medications that are given after the heart operation, is it linked? Is it linked with the dementia or forgetfulness? No, there is no link. If you are already have early dementia or depression, then it could happen. So we all are in confusion. The blood in our body, cholesterol, sugar, or the other things that those things that are reason for stroke or heart attack is not only affect the heart but it affect the whole body. So overall you have to manage your health in this country or any other place. There is no doctor who can prescribe the medication that could be that could damage your health. So take care of your health. Yes, is healthy approach is very important. There was there are billions of people who don't have doctor, they are managing, so you can manage. We are depending too much on the system or on the on the doctor, and that's damaging. The next question is for Kashmir ji. The question is, if there is so too much stress, so how it affects the heart. In the presentation we agreed whatever we think, it affects the whole body. When we are stressed out, we know on our heart and other organs get affected. There is a connection. So we also talk about what we can do to manage our life more. So if we change few things in our life, we can slow down our life. Or if there is a issue, we can go talk to someone, and it really makes a difference. Thank you. Next question is for Vaneet. This question came many times. How many times we can have tea during day? Okay, because the answer to this is lengthy. So please give me that much time, and if I go over, let me know. People who don't know what is a registered dietitian, I tell for their information, registered dietitian. They are part of Canadian healthcare team, and our training, our education is a different. It's about holistic health and diet, how they are linked to each other, how they're connected. That's our expertise in healthcare. If your questions are related to that or any diet, then you can talk to the dietitians. Dietitians are present in public health. With the healthcare department, they work with them or privately. So you can talk to dietitian, because how much tea you can drink, it depends what you put in the tea, how much what percentage of milk you are using for your tea, how much sugar you are putting in, it depends on that. Other than that, our science, it doesn't consider tea a bad thing, but if we are having it several times a day, so what material, what things is replacing our diet, so that will affect our health. What tea is replacing in our diet? If you're drinking 2 to 3 cups a day during in the morning and didn't eat breakfast, so the balance in your diet cannot be achieved because you missed a meal. Sometimes we take tea and miss the meal. That will affect your health more. That's why the question how many times you can drink tea, the answer varies depending on your lifestyle, age, diet. But if you want a short answer, I would say that the tea in our culture, we only drink that time when we sit down and we speak from our heart. We share our things. If you have chances, if you are getting chances just to lighten your heart, talking about things, then But if you are drinking tea because your life is so fast and you cannot avoid it, then and the other things like energy, nutrition, sleep, health, you should be careful about that before talking about tea or decreasing the amount of tea. I hopefully I answered your question. The talking about tea, do read the history about tea, 150 years old. People, countries, people drink tea. It's not an issue. It's a kind of antioxidant in the body. But we shouldn't we talk about that. But the addition we make, sugar and milk you put in the tea, that's the one. If there is issue about intestines or stomach ulcer or something, but avoid the hard, like the one is very much boiled, and avoid that. But if you take tea 2 3 times, it's a social kind of thing too. If you are read the Indian Punjabi history, the colon cancer was very rare because everything was diet based. So don't worry that much about tea. The main issue is everything else we do. Yeah, how much you are eating, what you do, how if you eat laddus, gulab jamun with tea, burfi, and then you bring pinni in then the relatives are here. We're not gonna stop them from eating. In Surrey, where we are living, look at the shops. Whatever, did you ever ask what you put in these sweets? Did you ever ask? Go ask them. It's not about only tea. How how many calories in one rasgulla? 350. In one gulab jamun, 300 calories. Do exercise, walk, but if you eat two laddus, it's all gone in the drain. So these are the practical things. We are very simple people. So we should be straightforward. No excessive amount of money is also dangerous. One thing you need to remember is whatever restaurant you go to and eat food, I'm sure Vineet will agree with me. Do go see their kitchen, how much is clean, how much they are frying the pakoras in that oil. So all those things very important, crucial. So your doctor, your dietitian is all the specialists, whatever they're doing, do because you are not managing your diet, it goes into drain. Whatever work your healthcare professionals do for you. Look, it's not that we are thinking that there is a profession. You come to my office, if there my it's not clean. So if you are going to a restaurant, have the it's not clean, how you can manage? You go if you go to somebody's house, the washroom is not right, or it's not good hygiene, is smelling. It's not the you have to protect yourself. It's not about that person's personality or anything. Not that anything that's available and you eat it. You are paying for it. You tell them, you ask them, they will be embarrassed about that. Like, wow, how you make the sweets? Look, acid is important for the body in our saliva. It's very important for the absorption. We cannot stop it, but how you manage it, it depends on your acidic food, citrus fruits, oranges, all these categories. Avoid them, reduce it. I missed the talk. You should eat whatever you is comes in your fist. Yeah, eat according to time. The SAT. Our people are in a lot of confusion. It's only our diet that's responsible, and where we came from. There is a bacteria in the water. It It sits in our body and it gives us so much. I don't have time to talk about that because I was late. I didn't hear the whole conversation, whole talk. Control your eyes and your hand, and you will have a good health. I request to those people who send the questions in the morning, they are waiting for it. And if you can, I can please ask those questions. It's from the morning, this question. Silent heart attack. What is heart attack? There are blood vessels, there is valves, nerves. Why we feel pain? When the blood is not reaching to heart, the muscles start shrinking. So that's why you feel pain. Silent attack is when our nerves are not working. Because you are diabetic for a long time and you don't know if you actually have a problem or not. The common presentation is not a chest pain that we feel problem, shortness of breath while walk. While I go upstairs, I feel shortness of breath. Then you don't know silently is there is a problem going on in the heart. Silent means you don't know what is going on in your body. Diabetic patients, people who are with high blood pressure, with high cholesterol, whenever you feel shortness of breath, whenever you feel shortness of breath, meet your doctor, get the test done before we do where we're doing ECG. There is no point. Just go for a stress test, go for a scan, and then there is a confirmatory test, angiogram. It's called angiogram. There is no point of going beating the bush. The thing is, if you have excessive cholesterol, excessive sugar, excessive body weight, and if you have problem, then this is silent attack. When you don't know, it's not a magic. It's our body. Its presentation is like that it will not let you know. Next question. There are two questions. One question is yeah, the cashew, walnuts, triglycerides are more. Is it damaging? If one person is eating one egg per day, is there an issue regarding the cholesterol? And there is a myth about this question. Nuts, triglycerides. There are no triglycerides in the nuts. Triglycerides are in our body. There are things that increase those, and there are things that reduce. If we eat sugary food, anything we eat with sugar, then if you eat the peanuts that are coated with the honey or sugar, then we have to be careful with the glycerides. If you wanna lower your triglyceride, then consult the guide. Then eat nuts. HDL are present and they will help you to reduce your triglycerides. But how much? Whatever, that's the handful, like in your fist, and like not like we are eating cashew burfi, dry roasted without sugar, without salt. 4 5 almonds or cashew or walnuts. So these kind of things you can eat. The second question is about the eggs. Before there was a myth that the eggs have cholesterol, but the new science and evidence is you can eat eggs. That's what it says. Though you don't have to worry about your cholesterol, like how much eggs you eat. So maybe one egg a day, 7 eggs per week is moderate, and you can eat it. The next question is for Kashmir ji. If you want to see a counselor, how we can see a counselor? Do we have to go to doctor, or how we can see a counselor? Is it free To see the counselor, you can go online, BCACC, our association, but those services are costly, you have to pay for it. But when you are working for some business, you have extended healthcare benefits. You can get your death, you can buy glasses, you can clean your teeth, you read your package, mental health services, to read that if there are mental health services present. Sometimes you have to pay from your pocket, and then the counselor give you a seat, and then you can claim, you will get reimbursement. If you don't have that, and if you can't afford that, so then you can go to community services. They are low cost or free counseling service. There are available in the community health, as I told you earlier. So you have to advocate for yourself, and you have to research, and you will get a service from somewhere. The next two questions are for Dr. Cheema. Home is about home remedies. What are the home remedies? Are good? Are they good? The second question is, and the medication, the allopathy and homeopathy. The people who came from India or Pakistan, we are mostly Panjabi. 60, 70 year before, did you hear cancer? Somebody dying with cancer or heart attack? All these things we are doing. Whatever we learned from culture, lentils, garlic, ginger, spices, all those things are very important. So considering all these things, in the Western, they modified it, gave new name, our spices. For example, garlic, it controls the blood pressure, cholesterol, and anti-inflammatory things. Turmeric is there are capsules, it will improve your joints. They are very important. Everything in moderation. Second question is also related. If you have heart problem, you are taking aspirin, you are taking turmeric, and your blood will be very thin. Don't hide your medication from your doctor. Tell them, these are the things I'm taking, these are the medication I'm taking. Pay attention. The homeopathic or Ayurvedic medicine, it doesn't hurt you. No, it will not affect anything. Is for your prevention is very important to maintain your body. The second thing is, people who have less money, people who are in South India or near the coastline where the weather is good, environment is good, they use all these kind of spices. They are very healthy. They don't have heart attack. Their complexion is good. So all these things. So our culture, our civilization, our medication here is acute care medication. You tell your doctor you have heart attack, and you will have an operation, but your dietitian is going to tell you what the things to eat. Before, the diet was Mediterranean diet. There were many names here for the diet. The Punjabi diet, spices, all those things are good. And there are fights in the world because of these spices. The spices are very important for you. So take. Do you agree with me? Yes.
We are all trained. We go to the doctor, family doctor, specialist. They don't have answer for everything. A psychologist, dietitian, talk to them. Somebody who can coach you spiritually. If you go to the church and just pray there, that's not gonna help. Do some yoga, do some deep breathing, heart yoga. Avoid that. Yoga is fine, but sweating excessive sweating is not good. You just have illusion that's, they're taking your money. Uh, Sweating is to maintain your body temperature, to keep it cool. So do yoga, do exercises. Spices are important. So, good quality spices. Vineet, anything you want to add? Yes. I just want to say the real medication is your diet. Even in Western medication, or even say in Punjab, the balanced diet is important, the healthy eating. That's best preventative medication. If we bring some balance to it, eat healthy, then we can keep our health healthy. But once you need Western medication, then you should consult your healthcare team. There are many professionals in your healthcare team, and they can give you the best advice what to eat. Based on your medication, they can decrease the side effects of the medication and make it more effective. And we should add that into your diet when you're taking medication. There's so many foods that you should not be eating because they interact with your medication. So if you don't have any illness or disease, then look after your health and eat what's good for you. And if you have a disease, then talk to your medical team. Tell them you're trying these remedies. And the medicine is holistic these days. They can give you advice that according to our science, this is better. That going to eat more or less, or should you eat more or less? The nuts, the lentils. Dr. Cheema, 3 more questions. Then 1 more Kashmir, then 1 from Reed. First question: if somebody has excessive breathing, or they're having hard time breathing, is it lungs issue or heart? People who have asthma, they have different issues. But if you have diabetes, cholesterol, and you're having hard time breathing, especially going up the stairs, that's a big sign that you should see your doctor. It's not a minor thing. If you're having hard time breathing, going up the stairs, that's a big thing. Oxygen is not going to your lungs or your to blood. So, it's your lungs that check your heart. And asthma medication, use it properly. Talk to your pharmacist. It's not just you just go and say hello and get the medication. And to use the pumps, how to use the pumps properly, how many times you need to use it, pump or anything else they give you. Second question, I see. Second question is, if you're walking and you have shoulder pain, and if it is going on for 10 minutes, for so many years that you have this problem, should you see your doctor? It's a very simple answer. We should understand the shoulder pain and walking has no connection unless it's on the left side. Move your body, be active, some strengthening exercise there, as they mentioned. You're going to get well. No, you're not going to get well yourself. If somebody is diabetic, their muscles, I'm 70 years old. If I'm not walking, I'm going to get sick. The muscles are not going to move themselves. You need to move it and move your joints. And when you're moving, exercising, it's using sugar. It's a simple things you should pay attention. It's not doctor's job, it's your job. Last question for you. If somebody had a bypass, but their feet are really dry now, again, somebody had a heart problem and they had a bypass, they're diabetic, Do you think it was heart block? The blood goes all over the body, and it goes all over down there. The veins, the blood vessels, everything affects it all the way to the heart and to the feet and other organs, sexual organs. It affects everything. And if somebody has a health problem, had a surgery done, and it's getting swelling, and then they need to control their circulation. When you say go sit at home, don't sit like this. Push your legs up, and then improve your circulation. Lift your legs, do some massage, do some exercise. Best exercise you see to push it. Move your legs and move your limbs, even when sitting. Some people sitting and they're saying, give me water, give me food, give me tea. You should get up and, move around and do some circulation. Most of the people who are sitting here, they are fit. I don't see anybody who's that sick, but activity, you need to increase that a little bit. Some people say, Herline, walk, should I walk barefoot or not with shoes? That doesn't mean anything. Walk is walk. The dirt is not going to change anything in your body. Avoid those gimmicks. Thank you. Another question for me, then for Kashmir Vaneet. I got a question. Brand name and generic. Is there any difference between some they say brand name generic? Is it Altes or some liquids generic mix one? There's no difference. Brand name medications are only the companies that have their packet. There are so many years per patent. They have patent for 10 years. When that patent expires, then other companies can make that medication as well. So usually brand name, generic, it's the same medication. And just to keep the tablet stable, what they put in there, that's a little bit different. But the active medication is the same. Only thing is different, insulin. Insulin, a generic brand name. It's a biosimilar. A biosimilar means the medication, the structure of the medication, if you look at it under a microscope, it's the same. It's the same medication, and it's built the same, but it's not the same. Got it? Good? Thumbs up? Just want to add something. If you go to the pharmacy and go anywhere, doctor wrote it for you, Altes or any other medication, they're very expensive. You can't afford it. You have limited income. You can ask the pharmacist through your family doctor or directly yourself. Register yourself with PharmaCare. Participate. Your medications will be free. We get stuck in there somewhere. And you say the medication is not fine. All the medications, go get it yourself. There's no problem with it. It's the same pharmaceutical company, and sometimes have a 12-year patent in India. They make it. It's just up to you. You feel that it's different, it's cheaper. Cheaper doesn't mean it's not good. Next question for Kashmir. Kashmir, if you talk to anybody about your problems, is that beneficial? If you talk your heart with somebody, does it help? Well, you know the answer to this question. What happens when we keep everything in our heart, in our mind? We don't talk to anybody, we don't share with anybody. Does it affect us or not? Yes. But as we said earlier, if we have tea with somebody, you talk to somebody, you share with them, I'm like this, how are you? Don't you feel lighter? Don't you think, they listen to you, you heard them, it affects, it helps you. If you take it to the next level, first the counselor, there are no counselor therapists. You just talk to somebody who's close to you. But now, if it is something serious, our friends or relatives are not able to help you, then professionals can help you with that issue, right? But everybody should have a person or two in their life that they can talk openly with. You asked a question, do you need doctor? I forgot to answer. You don't need a doctor's referral for psychologist, psychiatrist, for a counselor, but for psychiatrist, you need doctor's prescription or referral. Last question of the day for you, Neet. It's a very big question. You said coconut oil is not good. We have been using coconut oil for years. What do you think about coconut oil? The coconut oil, we call it saturated. We consider it saturated fat. The saturated fat is built in your body itself. We don't consider it fat. If we increase saturated fat in our diet, it's gonna go in there, and it's gonna create plaque in your blood. What we call metabolic processes. Your question is, there's some countries, there's some places, they've been using coconut oil for years. Even in Punjab, we used to eat a lot of saturated fat, milk, butter, buttermilk. But now our lifestyle here has changed a lot. We don't live in a warm place or hot place, and we don't work as hard. So that's why our saturated fat, we need to decrease it in our diet so that it doesn't go into your body and get stuck there and affects your heart disease. Some people have their coconut oil their whole life and it doesn't affect them, but look at what they did throughout their life and what kind of work they did. I just want to thank all the speakers that you explained everything and answered all the questions so simply and clearly. Now, going forward, there are two more door prizes that are left. So I'll ask you to pull the tickets out, and Herleen will pull out a number. And there are two prizes that are still pending. Last time somebody got a ticket, so please, I'll give you another second or two. If you're ready, you can give me thumbs up. Many people are ready. First one is 470. And from now on, we sow a seed into everybody's mind about knowledge. And they're outside, and there are flower plants on every table outside. And as I said, we give you knowledge today that you can take those plants just like those are outside. Thank you. And I wish to thank our community partners that gave us sport to promote and make it successful. And thank you for media partners as well who improved it and told about this every event, and you could be here. And the presenters outside, the exhibitors, and you went there and you gained the knowledge, and I wish to thank them as well. BC Reno, City of Surrey, Diversity Options, PICS, Richmond Multi Community Services, Self Management BC, South Asian Health Institute, Surrey North Delta Division of Family Practice, and most importantly, the speakers And I wish to thank them very much from bottom of my heart. Dr. Baldev Singera, Dr. Tarun Sharma, Vineet Kaur, Kashmir-based Dr. Guljar Cheema, Harleen Chauhan, Ajay Singh, who gave us, fresh in our mind, Indeep Sidhu, and Heart and Stroke Foundation, and translators who, some speakers who are learning. Thanks to the interpreters as well, Navdeep Atwal and Pradeep Bains. And from Ministry of Health, Ministry of Partners, and UBC as well, and Ripajit as well, who hosted this event today. Thank you. And first of all, I wish to thank you, all of you who came here and participated and made it us aware about our health and give us wonderful information. You can get all the information, whatever we did today, the recording and everything. We'll put it on our website, www.iconproject.org. If you have borrowed any headsets, please return it at the registration before going. Our next event, and it's about chronic pains, to understand and manage it, will be Dr. Smith Chawla next Saturday, March 16, Guru Nanak Sikh Gurdwaras. And you're most welcome to join us there and attend the workshop there. Thank you. Salutations. Goodbye.